Today's date's May 16th, 2019. This is Michael. Michael has come to us all the way from North Carolina. And Michael has 3 years of almost horror in that part of his body. You have been cultured with ureaplasma, which is a germ infecting your genitourinary tract, correct? You've had a multitude of antibiotics.
Yes.
You then got C. diff in your gut, which tore up your gut.
Correct.
No one's been able to fix your urinary issues,
That's
right?
correct.
You have chronic pain 24/7 around your perineum.
Yes.
That's the area between the scrotum and the anus. And in your skin, in your upper inner thighs.
Yes.
Right? And it's been red, irritated. If anything touches it, it bothers you.
Correct.
Right? You have pain on ejaculation. Do you have pain on on urination?
Not. I mean, when it first started, yes, but not so much anymore.
Not so much now.
Yeah.
And you can urinate okay?
Yeah.
Okay. And so they have diagnosed you on several occasions with not just ureaplasma. You've had at least 4 organisms.
Multiple infections.
Multiple infections in your genitourinary tract.
Yeah.
And no one's been able to fix this, and that's why you're out here, correct?
That's correct.
All right. Did anybody ever ask you about your mouth?
No.
I'm the first one.
Yes.
All right. So I asked you about your mouth, and what we know is going on here is you have an implant right there. That's tooth 27, but right next to it is tooth 26, and show with your left hand how that tooth is loose. Okay, that tooth actually wiggles a little bit.
Yeah, it does.
And it's been somewhat uncomfortable, correct?
It's...
Okay. So you have discomfort down in that area as we speak, correct? All right, I'm going to make a little injection into that, okay? Michael, you're laughing. Now, we just shot your tooth.
Yeah.
What happened to your legs? Remember I tested the muscle in your legs?
You did.
They were like putty, weren't they?
And
you couldn't hold your leg up, correct?
That's
in other words, here's your leg, this leg, and you couldn't hold it up. When I went like this, you rolled off the table, and now it's really strong, yeah?
That's true.
What do you think?
That's pretty amazing, actually.
Okay. I haven't asked you this before, so it's fresh, and the film's rolling. How's the discomfort in your pelvis right now?
It's actually a little better, oddly enough. I did notice it right after you gave me the shot. Yeah, oddly enough. Yeah, it's pretty weird.
If you could rate the pain on a scale of 10 minutes ago, and 0 is no pain, what do you give me now?
I'd probably give you a 1 or 2.
It went from 10 to 1?
No. So I was rating the pain previously as maybe a 5 or 6.
Oh, okay.
Yeah.
So the pain was a 5 or a 6,
right,
and now it's down to 1 or 2.
Yeah.
So if that's the case, that could be up to an 80% relief from just injecting.
That's pretty amazing.
Right there.
It's actually pretty amazing.
Okay. And you didn't expect that, did you?
I did not expect that.
Okay. I want to be able to post this on YouTube. Do I have your permission?
Of course.
Thank you. You said this is pretty amazing and you can't believe it, right?
That's correct.
All right. We just did tooth 26, second incisor. What organ is that related to?
The bladder.
The bladder and...
the urogenital.
And kidney.
And the kidney.
All right, so
that's...
that's...
You know what else I noticed is the connective tissue issues.
Yes. So you're dealing... That tooth has been problematic for over 10 years. You've had issues for 3. There's an implant next to it. The implant tested negative. So that tooth has probably been infected or problematic for years. You had jaw surgery, which altered your teeth. It probably damaged that tooth. And that tooth in the kidney meridian controls your reproductive tract.
That's pretty crazy.
And I was onto that immediately when you walked in the door.
And which tooth was that?
That is tooth number 26. Excuse me. Tooth number...
But what's interesting is that...
26. It's the second incisor.
But what's interesting is, as I mentioned, is that we moved this tooth. I think we moved this tooth to here, and I'm having these issues as well.
They're the same. They're in the same meridian.
I'll be darned.
All 4 incisors are connected to the kidney bladder meridian.
That's nuts.
All right? That muscle that I just checked on you, which is the psoas muscle, PSOAS, is considered the strongest in the body. It was really weak in you. It's amazing because you need that muscle to go up. It supports the whole spine, and it was like putty. It's connected energetically to the kidney meridian. So the tooth poisoning the kidney meridian weakened that muscle. I took it out of the circuit temporarily.
Yeah.
This is not a cure.
Right.
And I took it out of the circuit temporarily, and you got strong instantly. Are you getting the picture?
That's pretty amazing.
Okay.
It's pretty crazy, actually. That's pretty crazy.
How's the pain?
It's hard to tell because it's worse when I sit down.
Sit
but
down.
I mean, yeah.
Sit down. Come on, I'm having fun. This is entertaining for me.
It seems a little better, actually. I mean...
Well, before you said it went from 5 or 6 to 1 on a scale of 10. Is there any pain left?
There is. There's still some burning pain.
Okay, but it's significantly better.
Yeah, it is.
All right?
Yeah.
It's at least 50% better? I don't want to put words in your mouth.
No, yeah.
Okay. That's very, very telling. That says that tooth is primary to this problem. Now, I'm not telling you that fixing that tooth is going to get rid of the infection. I know you've got ureaplasma and other things.
Right.
But I think that tooth weakened your system to allow this infection. Am I making sense?
You are.
So you have asked me also, you want me to inject your prostate. We can do that.
Correct.
We can also do a 10 pass. My purpose in making this video was going after the source of the problem as I see it, which I believe is a disturbance in tooth number 26.
Okay.
It might have been 25. I don't know what they did.
Yeah.
And its impact on your kidney meridian.
Okay.
All right? Thanks. Michael, you live in North Carolina, in the Raleigh area, and you've been to 2 major universities there, including Duke, correct? And you said that they don't even want to see you. Is that correct?
Well, when I got the referral to go to Duke, I had already been diagnosed with chronic pelvic pain.
Yeah.
And so I waited and waited for them to call me back, and they never did call me back. And so I called them, and the nurse basically said, well, the doctor's decided he's not going to see you. And so I basically begged for an appointment, and I got a PA. And I went and talked to the PA, and she had, I mean, again, once they diagnosed you with chronic pelvic pain, that's pretty much...
That's it. They don't want to do anything because they can't do anything.
Correct.
And you've cost the system probably tens of thousands of dollars with this, and no one got anywhere.
That's correct.
How's the